Yes, sir. As a member of the baby boomer generation, I've been contributing to Medicare through payroll taxes for over 30 years. How do you propose to keep Medicare financially solvent for the next 50 years and beyond?
Let's start with Dr. Paul on this one.
Well, under today's conditions, it's not solvent and won't be solvent. You know, if you're an average couple and you paid your entire amount into Medicare, you would have put $140,000 into it. And in your lifetime, you will take out more than 3 times that much. So a little bit of arithmetic tells you it's not solvent. So we're up against the wall on that. So it can't be made solvent. It has to change. We have to have more competition in medicine, but some revamping has to occur. What we need is competition. We need to get a chance for the people to opt out of the system. They talk about opting out of Obamacare. Why can't we opt out of the whole system and take care of ourselves?
All right, let's continue the conversation. Governor Pawlenty? Congressman Paul says opt out. Congressman Ryan says squeeze a lot of savings across the federal budget, including a lot out of Medicare, to turn it into, and he doesn't like this word, but turn it essentially into a voucher program. Instead of having the federal program, the government would give you some money and you'd go out in the marketplace and shop for it. Is that the right way to do it?
Let me first address the doctor. Doctor, you said in your question that you paid in your whole life, and we respect that. People have made plans, particularly people who are on the program now or close to eligibility. We should keep our word to people that we've made promises to. I'm going to have my own plan, John, that will feature some differences from Congressman Ryan's plan. It'll feature performance pay rather than just volume pay to hospitals and clinics and providers. It will allow Medicare to continue as an option, but it'll be priced against various other options that we're going to offer people as well, and some other things. And I also said, if it was a choice between Barack Obama's plan of doing nothing, we have a president of the United States, got one of the worst crises financially in the history of the country, and you can't find him on these issues. He's missing. I'll lead on this issue.
All right, Governor. Mr. Speaker, I want to bring you into this conversation because I'm looking down. I want to get the words just right. Your initial reaction to the Ryan plan was a radical right-wing social engineering. Then you backtrack. Why?
Well, first of all, there was a very narrow question which said, should Republicans impose an unpopular bill on the American people? Now, I supported the Ryan budget as a general proposal. I actually wrote a newsletter supporting the Ryan budget, and those words were taken totally out of context. I'm happy to repeat them. If you're dealing with something as big as Medicare and you can't have a conversation with the country where the country thinks what you're doing is the right thing, you better slow down. Remember, we all got mad at Obama because he ran over us when we said don't do it. Well, the Republicans ought to follow the same ground rule. If you can't convince the American people it's a good idea, maybe it's not a good idea.
Should the Republicans slow down?
No, we have a $1.4 trillion deficit, and it isn't getting any better anytime soon. We have to deal with this problem now, and what Paul Ryan has suggested, which I wholeheartedly support, is to use a program that is identical to what seniors already have. It's called Medicare Part D. They have a program right now, which seniors like. It is a program that's called a premium support program. We give seniors, depending on income, a certain amount of money so they can go out and they can purchase health care that they want that helps them. And this is the key, John. We need to include seniors in controlling costs. What President Obama, let me finish, please. What President Obama has done is he put in the Obamacare bill, the Independent Payment Advisory Board. Ladies and gentlemen, seniors, Medicare is going to be cut starting in 2014 by the federal government, and it's going to be rationing of care from the top down. What Paul Ryan and Rick Santorum want to do, which is not radical, which is take a program, Medicare prescription drugs, that is 41% under budget because seniors are involved in controlling costs, and apply it all to Medicare. It is the right approach for Medicare.
The Speaker's point, Mr. Cain, was that if you've lost the American people, if they're not following you, you have to slow down until you can get them with you. Is that a fair point?
We don't need to slow down. I hate to tell you, I hate to be the one to give you the bad news, doctor. You're not going to get most of the money you put into Medicare if we don't restructure it. The reason we are in the situation we are today with Medicare and Social Security is because the problem hadn't been solved. We can no longer rearrange it. We've got to restructure those programs, and the Paul Ryan approach, I totally support. And he has been very courageous in taking the lead on this.